Hello, welcome to Chatting with Chitness. I'm Dr. Salil Chitness. I'm a pediatric emergency medicine physician, and we're going to be talking about pediatric medical education. We got a very exciting video, so let's get chatting. And today we're going to be talking about a very big topic. We're going to be talking about ear infections. I know most of your parents probably already are familiar with them, but let's just go through them real quick. So there's really two main types of ear infections that kids get. One is called otitis externa, which is on the outside, and the other is otitis media, which is on the inside, and that's the one that's more common. So the first one we're going to talk about is otitis externa, which just means, outside ear infection. And this is also what we call swimmer's ear. And the reason why is usually happens in kids that swim a lot because their ear canal stays wet, and then that's just perfect for bacteria, and they kind of infect the canal. So the infection's all on the outside. And the best way to treat this is just antibiotic drops that you put directly into the ear canal. Really the best way to prevent this is to really just make sure your kids' ears are dry after they go swimming and showering, just to keep that ear canal not a good environment for bacteria to start growing. All right, let's get to the most important one, otitis media, which is the ear infections that most kids get. And this is an infection that's on the inside of the eardrum, so you really can't see it from the outside. That's why we have to use that little tool we have and look inside kids' ears to see that infection. And the most common cause of this infection is usually when kids have a cold. That's why most kids get this ear infection when they're sick. And it's because the congestion in their nose will build up into the ears, and then it just sits there, and then it gets infected. As we grow older, we don't have that issue, and that's why adults tend to not have ear infections as much as kids. And most of these ear infections are actually viral, but there's a small percentage that are bacterial, and that's why we treat them, because they won't get better without antibiotics. And usually your kids will have the classic symptoms of like a lot of pressure in the ear, a lot of pain. They do get fevers from these ear infections. And then one of the late signs would be pus coming out of your kid's ear. And that's because the eardrum actually has popped from all the pressure. And they tend to feel better after that. But they definitely need to get treated because the eardrum will not heal until the infection is better. There's two schools of thought when it comes to treating ear infections. There's the watch and wait, and then just treat right away. And the reason for the watch and wait is most ear infections are viral, so they should get better on their own, and then you don't have to put your kid on antibiotics because antibiotics have side effects. Usually, if they're under 2, we just treat and not do watch and wait. But if they're over 2, you can do the watch and wait. I usually just have parents decide if they want to start right away or they want to watch and wait. There's not much you can do to prevent ear infections. The only studies that have been shown to help prevent ear infections is actually smoking in the household. So in households where there is smoking indoors, those kids tend to have more ear infections than non-smoking households. If your kid does have ear infections a lot, then it might be important for them to go see an ear, nose, throat doctor, because they'll put tubes in their eardrum, and what those tubes do is it's just like a little hole that lets all that congestion drain out. So if it can't build up, it can't get infected, and that's kind of how the tubes work. And that's a wrap on ear infections, one of the most common things I see, and most kids will definitely at least have one in their lifetime. Please leave any comments so we can chat about it next time on Chatting with Chitness.